Hi, my name is Amy Scott. I'm a Community Health Alliance intern from the University of Nevada, Reno in the Masters of Public Health program. Community Health Alliance offers 6 clinics within the Reno-Sparks area. Community Health Alliance historically came together in 2011 when 2 nonprofit community clinics merged, Hawk and Mission Outreach. What is CHA and what does it do? CHA is a federally qualified health center. They accept insured, underinsured, uninsured patients, and they help finding prices affordable to these patients. Services include medical, dental, behavioral, complex care management, and they even have a 430B qualified pharmacy. They also have community advocacy. They collaborate with community partners in the 3 area hospitals, Renown, St. Mary's, and Northern Nevada. They have multiple locations within the Reno-Sparks area. Sometimes patients come into the health system because they don't know what they're doing, they don't know what's going on, or they have risks that they are not caring about or even aware of occurring. When these patients come into the emergency room, they come in possibly not understanding the role that primary care providers offer. They arrive at the emergency room and they cycle through, and patient information is gathered as care is provided. Patients arrive, they're treated, they're discharged, and ideally arrive at the primary care provider appointment. They receive care, and there's a point where there's transition of care and patient, inpatient, or in the emergency room patient contact. When the patient is discharged, the idea is to have them established at a community health primary care provider if they do not already have a provider within the area. This is to break the cycle emergency room utilization. So within this cycle, the hospital throughput, which is the process of them moving through the hospital system from intake until their discharge, the idea is to connect them to the appropriate resources. But what happens? Sometimes there's an interruption in this cycle. What are the barriers and gaps? The overview of the key health issues that I looked at were the no-show rates to primary care appointments scheduled at hospital discharge, the available data sets for January 1st through May 31st, 2017, and Community Health Alliance data varied by hospital discharge scheduling process. There was differences in definitions, processes, and different mission, vision, and goals of the 3 hospitals. My internship project was to observe and follow the patient through the discharge scheduling, identify gaps and barriers, and then to assist in process improvement by providing the findings with the stakeholders. As a patient enters, at Renown, they are connected to Community Health Alliance through the ED discharge or through the inpatient. At St. Mary's, with using contracted services of access to health care, only those patients who are inpatient may be chosen to go through a care coordination process. At Northern Nevada, this is the newest relationship, and patients are connected at the ED discharge with patient information provided to Community Health Alliance. My objectives were to orientate, create questionnaires, key informant surveys, observe and shadow, administer questionnaires, analyze data, present to CHA, get feedback on the presentation, create a written report and findings for Community Health Alliance, create care transition flow sheets, and for these, I had to reevaluate how this was occurring due to some inability to gain data. Competencies were leadership, professionalism, communication and informatics, biostatistics, health policy and management, looking at the management and evaluation and organizational and community initiatives, discuss the policy process for improving health status of populations. High-quality discharge characteristics is synergistic response from the hospital discharge and patient and community with shared understanding of risk factors and collaborating. I would like to thank my preceptor, Chuck Duarte, and my advisor, Dr. Trudy Larson. The key informants of Access to Health Network, key informants at Renown, key informants at REM,